Good morning, everyone. I'm Katrina Peters, Director of Programs and Projects. Thank you all for joining us for this morning's Echo, where we're going to be talking about community health improvement plans.
And just one quick announcement to everybody. I see a couple people using it already. Feel free throughout the talk to write in using the chat function or the Q&A function if you have any questions, and we'll stop and address those for you.
Great. So as I said, I'm Katrina Peters, Director of Programs and Projects at the Washoe County Health District. And today, I'm going to talk about community health improvement plans. So first, I wanted to just do a brief introduction so folks could kind of have a bit of a feel for who I am and how I came to this role. I'm new to public health. I'm a bit of a public health interloper, and I've been in the role for about a year. I had lots of experience in federal nutrition program management, federal grants. I'm a bit of an idiot savant on school nutrition. I would consider myself to be a data nerd, and also had a lot of experience and really enjoy building community relationships. But one thing I was not coming into this role as a CHIP expert. I'm also not a public health expert, but I am a good question asker. And I'm going to talk a little bit today about how important asking questions is when you're developing your community health improvement plan. Today, I'm going to talk a little bit on some of the basic steps in the community health improvement plan development process. I'm also going to share kind of some tips and tricks, things that I would like to have known before I started this process. And then we'll switch and I'll talk a little bit on some of the details of the community health improvement plan that we developed here at Washoe County. All right, so our objectives for today are to first describe the process of community health improvement planning. Second, to be able to identify 3 benefits of a community health improvement plan. And third, to describe the benefit of including SMART objectives in a community health improvement plan. And I'll talk about what a SMART objective is. First, I wanted to give 2 definitions for some acronyms that I'm going to use pretty consistently throughout today's presentation. So the first is a community health needs assessment. It's often also referred to as a CHNA. People use different acronyms for that. There's also a state level equivalent of a state health needs assessment. I'll also use the acronym CHIP quite a bit, and that stands for the Community Health Improvement Plan. There's also a state level equivalent of that, which sometimes is called the SHIP. To talk a little bit about the history, CHIPs are a little bit of a newer thing. So they're required for state or local health departments who are pursuing public health accreditation. And that really kind of was the initial push for folks to develop CHIPs and also do a corresponding needs assessment. Sometimes folks combine the needs assessment and the CHIP into one document. And that's an approach I've seen quite a bit, and there's definitely some pros and cons to that. We took a bit of a 2-step approach and have 2 separate documents. Another thing of note is that CHIPs are typically written for a 3 or a 5-year time period. And when you have a multi-year document like that, it can take a little bit longer to learn about what the best outcome is. So when researching CHIPs, I don't see too many that are any older than 2010. So that gives you a little bit of a picture of how this is a bit of a newer process. And thinking about those multi-year documents and how we can get learning lessons typically at the end, it's like the opposite of rapid cycle. So it's really critical not only to network with other folks doing similar work, but also do some research on what other CHIPs look like and what the outcomes of that were. What's the purpose of the CHIP? So to start with a really sort of academic definition, it's a long-term systematic effort to address public health problems in the community based on the results of community health assessment activities. And that's from the Minnesota Department of Health. I think that captures it pretty succinctly. But thinking a little more broadly, I like to think of a CHIP first as a magnet to bring your community partners and stakeholders together. It's also a great place to make those tough decisions on what we're going to work on together and focus on to align those goals. You also have to craft it in a plan. So it gives you an opportunity to write down those goals and who's going to be doing that work in a document that folks can reference over the course of that multi-year document. Ultimately, the goal really is to improve the health of the community. So thinking about that broader overarching goal, improving the health of our whole community is really where that's at. What are the benefits of a chip? So the chip, again, is really going to help you align your community on some common goals. And it's a tough process. Those are tough conversations. But when we have everyone in the community sort of pursuing independent work and pursuing independent goals, the likelihood of success on improving the total health of the community is going to be less likely than if we're all working together towards a common goal. It's also a great opportunity to build some stronger partnerships across your community. It can be a great venue to cut across silos. So especially when resources are scarce, folks are really busy, a lot of work that they're trying to do, sometimes that can lead to siloing, and the chip is a great opportunity to cut across those silos. It also, again, provides an opportunity to focus on what problems we want to work on. So thinking about everybody kind of working on different separate goals, we're going to be more successful if we can get folks to agree on what problems to work on and to work on those together. It's also a great opportunity to elevate the profile of public health. Some of the items that were in our chip were struggles that folks were very clear on in sort of those smaller work groups. The chip was an opportunity to say, hey, here's this problem, here's this thing we need to work on as a community, and be able to elevate that to a higher level, get it out in front of a broader audience, and be able to talk about it with more people to increase the likelihood that we're going to be able to solve that problem. What's the basic process? So I've sort of broken down chip development into 4 steps. And again, I'm not a chip expert. We've looked at some models, and I'll talk a little bit about those. But having done this work, this is sort of how I break this down into 4 steps that are a little easier to understand. So the first is gathering that primary and secondary data on your community. And folks typically do that, again, through that needs assessment. There's some models out there on how to go about that work. Typically, it's around a health focus. So gathering all that health data, all those health-related statistics, looking at all those health indicators. But I also really want to advocate for folks looking at those social determinants of health and getting a little broader picture on what's going on in your community. So looking at things like education level, transportation barriers, income levels in your community. We know those things have huge impacts on health, and I really want to strongly advocate folks to include that in your community health needs assessment when you're gathering that primary and secondary data. The next step is to do a data-driven prioritization, and I'll talk about that in a little more detail, but getting a prioritization around your data can really help in sort of cutting through that fog. So for those of us who love data and love to get lost in those spreadsheets and those numbers, we are probably the outliers. So most folks don't enjoy a huge mountain of data to comb through, and doing a data-driven prioritization can help elevate those top needs in your community and provide you an opportunity to communicate the data in a little more concise fashion. Next, you want to share the results of that needs assessment with your community and ask what they want to focus on. So when we're thinking about primary and secondary data, it's great to have all those statistics, know what the large gaps in your community are, but going out and asking your community, what work do you want to do, is really, really, really important. So if the data says, hey, here's our top thing that we need to focus on, and no one in the community wants to get together to do that work, the chances of success are going to be pretty slim. Also, next in that process of talking with your community, you're going to need to get folks together and make some decisions on what to focus on. And I think this is really the hardest part. So for those of us who have tried to get community groups together or worked in work groups or through committees, you know sometimes it can be really hard to make decisions on what work to do, and the chip is not unique in that. So this is the hardest part, and we're going to talk about some tips to try to make those decisions a little bit easier. Then finally, the 4th step is to make a plan reflecting how you're going to go about doing the work of addressing those high health needs in your community. You'll also, of course, want to monitor your progress, and you may need to adjust accordingly as time goes on. So I like to describe this process that I just went through in those 4 steps as something I call our community health roadmap. So our first stop in that roadmap is assessing the needs of the community. And again, that's typically done through that community health needs assessment. Next, you're going to determine your priorities and engage the community on how to go about the work of solving those high priority health problems. The third step is crafting a plan on how the community can work together to solve those high priority health problems, and that's through the CHIP. Once that 3-year CHIP is over, 3 or 5 years, depending on what you've decided to do, then you start that whole process over again. And here in Washoe County, it's our second step, or our second cycle through this. I wanted to talk really just briefly on what some of the models are for doing this work. So in addition to sort of reaching out to other folks who have done CHIPs and doing some networking, finding out what worked well for folks and what were some challenges, it's also a good idea to take a look at what some of the models that are out there to help with this work. So one that's commonly talked about is MAP, or Mobilizing for Action Through Planning and Partnerships. There's a lot of great resources on the NACCHO website, so I wanted to provide that link here. And MAP gives some great steps to follow. So it outlines 6 main steps that I think are really good before you start this work to review and think about how you might work through those steps. When you're starting a CHIP, I want to really encourage folks to think about how they're going to go about doing that work, and MAP can help line you up with some steps on how to start that process. The next model that I think is helpful is the collective impact model. And that collective impact model has been around 20 plus years. If you Google collective impact model, you can find a lot of resources and tools. And I think what it really did for me is provide a great framework of how to think about going about the work. So it's different in MAP in that it doesn't really lay out sort of a step-by-step process, but it gives you a framework for thinking about what roles and responsibilities you're going to need to reflect in that community health improvement plan. So you can kind of see on the right, the 5 conditions for collective impact that they outline are a common agenda. So again, thinking about getting our community together with the ultimate goal of improving the health of our community, we need to come together on a common agenda and decide what together we're going to work on. Shared measurement, another critical element for the CHIP, and we're going to talk about how to measure and some different ways of measuring your CHIP outcomes. Mutually reinforcing activities, so again, aligning on those common goals and working together. Continuous communication, not only in the development of the CHIP, but once you start working on implementing that CHIP, having that continuous communication is critical to keeping folks engaged in that work over that 3 to 5 year process. And then finally, they outline the need for a backbone organization. And here in our county, we serve in that backbone role, but I think it's important as you start that needs assessment and that CHIP process to think about who would serve as that backbone organization. And while we want to bring community partners together, and there's likely a lot of existing nonprofits and government entities in your community doing great work, it helps to identify someone who's really going to track the progress, keep meetings going, and really provide the structure for moving forward in that work. So there's several other models out there, but to me, these were the 2 that sort of resonated the most and that I think helped shape up how to go about the work in our community of developing this CHIP. Right, so to do a little deeper dive into the steps, step 1 is gather that data. And folks typically do this again through that community health needs assessment. You'll want to look at your primary and your secondary data. You'll also want to think about some qualitative and quantitative data sources that you could tap into. We've recently submitted all of our documentation for accreditation, which is really exciting. If you're pursuing accreditation, they have some really specific items that they want you to include in the needs assessment in the CHIP. So if you're working on a needs assessment in a CHIP because you're pursuing accreditation, really want to encourage you to look at those accreditation measures for the needs assessment in the CHIP, and that can help outline some of the things that you'll want to include in both of those documents, or in your one document if you're going to combine the 2 together. Nonprofit hospitals also have to do a community health needs assessment. So I want to encourage folks to do a little investigation, and if there are nonprofit hospitals in your community, you might want to initiate a conversation and see if you can partner with them. So here in our community at Washoe County Health District, we partnered with Renown, which is our only nonprofit hospital in our area, and we were able to share that needs assessment. We both put in funding to pay for the staff time to develop that document, and I think that really worked well. When we're thinking about trying to do a robust needs assessment of our community, that's a really big undertaking, and if folks can come together and partner on that, really want to advocate for that approach instead of 2 documents that may be covering different things or different sets of data. I think pointing to one document and one data set, pointing to one document and the data within that document, there's really a benefit there. Also want to encourage folks to reach out and involve your community subject matter experts. So in every community, there's no one person who's going to know everything about the needs of that community. So really reach out to your folks who are those subject matter experts, and looking at things like your universities, your education centers, and then folks all across the different agencies doing work and nonprofits doing work. I'll talk a little bit more about our needs assessment, but I think that was really one strength, is the really substantial amount of subject matter experts that we're able to pull into that process, and say, hey, are we looking at the right data set? Is there something else we should be considering here? I think that really builds accountability and makes that document just so much stronger. All right, step 2 is that data-driven prioritization. And this isn't necessarily a required item according to FAB, but it's something that I really think is something that folks should strongly consider, and something that I think helped us in that painful process of making decisions on what to focus on. So most people are easily overwhelmed by data. So here I've got my little picture of a fire hydrant, and my analogy there is looking at all the data in our needs assessment is a bit like trying to take a drink from an open fire hydrant. It's really easy to get lost in a lot of data, and when we're thinking about pulling in community members to help make decisions on what to focus on, folks aren't going to comb through 300 pages of data as much as I would love them to. A data-driven prioritization is a great way to say that we looked at all the data, we applied a methodology to what the top priorities are and what the most pressing needs in our community are, and here's what those results look like. So again, just really want to advocate for using that prioritization to help tee up those decision-making conversations on what work to focus on. When we're thinking about that prioritization and looking at the data and how we're going to make decisions on what work to focus on, I want to encourage folks to think about that sweet spot between your secondary data, which is all that statistics, the census data, youth risk behavior survey, VRFSS, that whole mountain of data, and then also looking at your primary data, which is your opportunity to figure out what the community perceives as important. And when we overlay those two, that sweet spot for success is going to be between those two circles. So again, if we're looking at the data and we identify some high needs areas, and then we go out and talk to the community and no one wants to do that work, it's not likely to be successful that we're going to be able to make progress. All right, so thinking about once that needs assessment's done and we've combed through all that data, prioritization can really help cut through that fog, and it can help tee up a nice jumping off point for deciding what you want to focus on. And again, deciding what to focus on is the hardest part. So, thinking about my own personal experience, even conversations with my significant other about things like what to have for dinner can sometimes be a difficult conversation when we're getting the whole community together and saying, hey, what work do we want to do to improve the health of the community? Those can be very hard conversations and tough decisions to make. Want to also encourage folks to look for existing community groups or coalitions that are already convening. So in Washoe County, we looked to a group called Truckee Meadows Healthy Communities. They were a cross-sectoral coalition, and they have a really wide variety of representation: business owners, government, nonprofits, law enforcement, healthcare providers. And that existing coalition, we were able to tap into to help us do the work of figuring out what health needs to focus on. So if you're in a community that has that coalition, that's a great venue to start having those discussions and to help make those decisions on what health needs to focus on in your CHIP. All right, step 4 in the process is going to be writing the plan. And I'll give kind of a brief overlook on that, and then we're going to go into some deeper details on things like SMART objectives and what to actually include in that plan. So again, thinking about what decisions to focus on, you need to ask a lot of questions. So the first thing I think is a great question, the first question that I think is a great question to ask is, what are our most pressing needs? And again, you can use that data, use a data-driven prioritization to tee up that conversation and make sure folks are up to speed on what that data says are the most pressing needs in our community. And then second, you need to ask the community, what capacity do we have to do this work? And I think this second part is the most important question. And I want to encourage folks to get a lot of people around the table when you ask this question. So if we identify some needs and we have no capacity or interest to do that work, unlikely to be successful. So we really want to make sure that the community not only buys into what those health needs are that we're focusing on, but also that there are folks that have some capacity to do that work. Also, I think it's critical once you identify those specific focus areas, you need to see that topic through and outline some steps towards progress. So thinking about those health needs, they can be really broad. And want to encourage folks to think about the layers underneath that and the really specific steps that are going to need to be followed to see some work moving forward on that. Finally, you're going to want to draft up that plan in a document and circulate it for feedback. So coming back to how important it is to ask questions and ask your community for their feedback. Don't be afraid to ask those stakeholders and subject matter experts what they think about your plan. We did this largely through committees around health topic or health focus area, drafted up in a Word document, and sent that out to our stakeholders and said, hey, please provide us feedback either in written form or call me and tell me what you think. That's valuable too. But really getting that community feedback is just so critical when we're working on the details of the plan. We also had a lot of community meetings where we were able to have conversations with folks. But even as you're drafting that plan and drafting up those details, want to encourage folks to really connect with your community and make sure you're getting that feedback from those subject matter experts. All right, to do a little deeper dive into what's in an action plan, and we refer to it as an action plan, which includes the details of how we're going to go about the work. Other folks use other terminology like implementation plan. No matter what you call it, this is the portion of the CHIP where you're really going to outline how you're going to go about doing that work. And I wanted to start with this quote I pulled off the internet: "A goal without a plan is just a wish." And I think this statement applies really well to the CHIP. So if we don't have the details and we don't have the plan on how we're going to accomplish a goal, it's not likely to be successful. So we want to really put some details in that plan. There are a ton of templates. I've provided 1 or 2 links throughout this presentation, and here I didn't even think a link was a good use of anyone's time. I really just want to encourage folks to Google it. There are not only some great examples of CHIP, but also some great templates out there. We relied and looked pretty closely on the CHIP that Bozeman, Montana put out. It was just laid out in some terminology and in an order that really made sense to me and I think was easy for folks to follow who aren't really into measurement. Again, Google it and you'll find a lot of great things out there to reference. Most plans start with a focus area, so that's a broader health topic, and then they have an aspirational goal, and I'll talk a little bit about aspirational goals, but then from that goal, they break that down into smaller steps. So folks typically kind of follow a format of a goal, and then an objective, ideally a SMART objective, and then some finer strategies or tactics that really get at the details of how you're going to tackle that work. And drafting these steps and working with those stakeholders and subject matter experts can help you think about what steps you're going to take to accomplish that goal. So again, thinking about sort of where to start, I'm a supporter of a broad aspirational goal. So when we're thinking about the work we want to do with the CHIP, that's often things like reducing obesity, maybe working on things like homelessness, or the number of mental health providers. We also have included some physical activity goals in ours. So when we're thinking about that goal of reducing obesity, that's a big aspirational goal. And I think that's a great starting point and an opportunity to sort of keep that high level intention in mind of what work we actually want to accomplish with the CHIP. Underneath that, I think it's critical that you have a SMART objective. And I'm going to break down what a SMART objective includes, because that can really provide that structure to the objective and put things like timeliness and measurability into that objective. And while I'm flexible on a lot of things, I feel really strongly about SMART objectives, and I like to phrase it that it needs to be SMART or it'll die. So objectives that are not SMART are likely to die a slow, quiet death. And making that objective SMART is a great way to help that objective work for you. So breaking that down, the first is specific, and that really makes it distinct from that larger goal. It needs to be measurable, and I'm going to talk in some details about how to measure that objective, but it's critical that there's a measurable component to it. The A, folks use several different terms for that. So some say attainable, achievable, agreed upon, or aspirational. I can buy into all of those. The next, with the R, kind of in a similar fashion, folks use a couple of different terminologies: relevant, realistic, or results focused. I can agree with all those too. And then finally, we want that also to be time-based, and that's going to kind of tie into that measurable component as well. Some other things to think about when you're including details in that action plan. I want to encourage folks to include who's responsible for leading and supporting a goal. So when we're thinking about carrying that work forward for several years, and we're also thinking about capacity, identifying who's going to lead and support that goal in the action plan itself can really help build some accountability and sustainability to that plan. You also want to spell out how you're going to measure success. So without this, you will not be able to clearly articulate your success, and being able to articulate success is not only going to be important for continuing to engage your stakeholders, but also continuing that momentum when you're going to pursue that next chip, when your initial chip is over and you're ready to start the process over again. I would also be remiss in my duties if I didn't mention that accreditation wants you to also include specific policies that need to be changed. We were a little thin on this in our chip, but in hindsight, this was something that I think we could have done a little bit more work on. And want to just let folks know that if you're pursuing accreditation, this is a component they'll expect you to cover as well. All right, to talk a little bit about measures, and this is a topic that I love, so folks have specific questions, please connect with me offline. I love talking about measurement. So I typically think about the measurements that we should include in the chip in two categories: process measures and outcome measures. So to first talk about process measures, those measure what action we are taking. So those are things like meetings conducted, that could be small work group meetings, that could be broader community and stakeholder meetings. It's things like developing or identifying resources and preparing critical documents. So when you look at our chip, you'll see that we largely have process measures. We identified kind of some more unique goals and objectives, and a lot of these we have a process measure on for a variety of reasons. To contrast that with an outcome measure, which is what is the impact of our activities? So outcome measures are things like decreasing homeless population, lowering BMI, items that are in that youth risk behavior survey and BRFSS. So things like risky behaviors, substance use, dietary behaviors like fruit and vegetable intake, also things like graduation rates. So those higher level outcome measures are things that are probably going to be in some of those national data sets. And I wanted to also encourage folks to think about the timing and the potential lag of those data sources and where your intervention fits in that. So if we're doing work on obesity and looking to lower BMI, and we're tracking that against the youth risk behavior survey that includes a self-reported BMI, there's going to be quite a substantial lag to that data. So if we're starting work in 2017 and we're tracking on the YBRS results 2 years later, we need to think about how that timing is going to fit and how there's a lag between when that data is collected and when it's reported. It's critical to have a good understanding of where your intervention fits so you know whether or not your intervention is actually having an impact. I also want to advocate for folks to consider using a mix of the two. I think those can really be a powerful combination. So those process measures allow you to show progress towards really large issues. When we think about those goals, those are typically things that are really tough to do work on and to show an impact on, but that's what we're ultimately there for, right? Is to improve the health of the community, and sometimes that means working towards a really large goal. But those process measures can help keep the work on track. They can also help define some of those smaller steps that we need to take to impact that change. And it also can provide a sense of accomplishment. So when we're looking at those giant goals and we're tracking on a 3 to 5 year process, sometimes it can get a little daunting, right? Like, are we going to be able to really actually do this work and have this big impact? But putting out some process measures can give you some benchmarks on how to go about that work, and to also collectively be able to celebrate some success when you do accomplish that process measure and you're able to check that item off the list. Outcome measures, I think, are critical to show if we're having an impact on that broader goal. But the challenge there is that data collection might not happen annually. It might only happen every other year. So those outcome measures can be a little bit not quite as timely to be able to know whether or not you're having an impact. And also, some communities may not necessarily have the resources to collect data on those larger outcome measures. A lot of folks sort of look to those national data sets, which is great, but we want to also be cognizant of how we may be limited in the resources to collect some outcome measure data. All right, so switching gears a little bit and talk about our process here in Washoe County. First, for those who may be joining us from outside the state, I wanted to talk a little bit about where Washoe County is. We're in the state of Nevada, and we're sort of right in that corner that bumps up right into California. We are a geographically large county. We're about 6,500 square miles. We have a total population of about 460,000, and we bump up right against Lake Tahoe. We are often confused with Las Vegas. We are in the same state, but we are not Las Vegas. We're a much smaller community, and we're about an 8-hour drive north of where Las Vegas is. All right, so of course, first we started with our community health needs assessment. I provided our link here so folks can access that. We posted it on our web. We've also really strongly encouraged its use for anyone in the community writing grant proposals, looking for data sources. It's in a nice tidy document and can really be a great resource for folks looking for data here in our county, comparing it to state and national benchmarks. It is chock full of data. It is a very robust 300-page document that covers a very wide variety of outcome indicators. We collected data and reported data on over 250 health indicators. I'm thinking about our quantitative data, of course. And as you can see here, it really has a wide scope. So we looked at those social determinants of health, in addition to things that would typically be included in a needs assessment, like maternal and child health, immunizations, communicable diseases, and mortality rates. I can answer some basic questions about our needs assessment, but if you have questions about sort of how we went about that work and really deep, detailed data questions, you're going to want to connect with our great statistician, Heather Kerwin. So I've included her email here so you can connect with her if you have questions. You can see a photo of here. Heather really has done a phenomenal job with this health needs assessment and is a great person to connect with if you have questions about the data and the crunching of that data. All right, how were our focus areas chosen? So in our needs assessment, we included a prioritization based on that primary and secondary data. And I came in kind of on the tail end of that needs assessment process, and when we were talking about that, I was so excited, like, oh, we're going to do this data prioritization. It's going to tell us exactly what to focus on. It's going to be a piece of cake. And that is not what happened. Here in our state and in Washoe County, we have a huge array of needs. And while we did a great job, I think, with that prioritization, it didn't really give us a huge distinction between health topics. And I'll show you the results of that. And one of our main lessons from our last CHIP, again, this is our second CHIP in that 3-step process, was to not take on too many objectives. We had over 60 objectives in our previous CHIP, and it just spread us way too thin. A lot of really great objectives included and some great intentions and work that needed to be done in the community, but ultimately thinking about that capacity, we really learned from that we don't want to take on too many. We really want to be focused and think about what capacity we have to do work. We utilized our Truckee Meadows Healthy Communities Steering Committee. So again, that's a cross-sectoral coalition that had a really wide variety of representation, businesses, healthcare providers, government agencies, really great variety from across the community. We met twice to discuss those priorities and make decisions on what to focus on. Those were 2 2-hour-long meetings, and those frankly were really tough conversations to have. When we think about our community and how many needs we have to address, it can be really hard to try to focus that and cross some stuff off the list, but we did it. Coming back to our prioritization, I wanted to sort of show folks what those results look like. So here we have our top 12 health need topics and their score. And you'll see that through these health topics, these are still really big things to try to solve. So when we look at our top one, access to health, you could come at that from a variety of ways: transportation, number of providers, health insurance. No matter which way you slice it, that's a huge topic to try to do work in. Second is mental health, similar story there, a very big problem to try to get your arms around. And really, when we look at those top 5, we had to take it to 2 decimal points to even get a distinction between these top 5 really giant health needs. But it did help tee up those conversations and help show where those biggest gaps are. To choose those focus areas, again, those were tough conversations. So when you see how many needs there are across our community, it's hard to sort of slice things off the list. But that's what we had to do to really figure out what we had the capacity and what we wanted to focus on. And for those conversations, we really try to encourage folks to think about 2 critical elements. One, what are our most pressing needs? So while we see we have a lot of needs, we need to focus on what those most pressing ones are. And then second, what capacity, and even more importantly, what desire does our community have to engage in a focus area? So again, if the data shows like here's our top most pressing need and no one wants to do that work, it's unlikely we're going to have success in including that in an item in the chip. From those conversations, we chose 3 focus areas. The first was housing. So here in Washoe County, we've had this huge economic boom after about a 10-year recession, and that has resulted in a pretty substantial housing crisis here in our community. So one, this was an item that just in asking our community what's most important, housing came up again and again and again. We also know that it's a critical foundation for health improvement. So when we're thinking about interventions and different strategies to try to improve health, especially in our lower income populations, if those folks don't have housing, it's really unlikely that those interventions are going to stick and be successful. So we knew that we needed to focus on housing first. Second is behavioral health, and we used that term to describe both mental illness and substance use together. We know this is tied to housing, and it was also cited as a top priority in our community. We have a lot of struggles, not only with funding and number of providers, but we knew that this was something that we really needed to tackle here in our community. Our third is nutrition and physical activity. And we know that these 2 items cut across many chronic diseases. It also gave us a great opportunity to focus on prevention and think a little bit upstream. So here in our community, housing and behavioral health are things that are just on fire right now, very urgent priorities, but also including nutrition and physical activity gave us the opportunity to also think about some prevention and how to try to help some things before they turn into larger problems. Once we made those decisions, then we started on the hard work of developing those action plans. And we had substantial community input on our goals, objectives, and strategies. We got together a committee around each of those health topics, had some conversations, crafted documents, circulated those documents for extensive feedback, and were able to really fine-tune what we included in those action plans. We also focused on items that had broad support from stakeholders, and you'll see in our plan that we've identified an owner. So that's someone who really sort of wanted to take the lead on that issue or was already a lead on that issue here in our community, and supporters. So those are folks who want to do the work, are interested in participating, but maybe didn't have the capacity or the interest to really sort of lead that and lead those groups to do that work. We included items that were realistic and achievable, but we also included some items that are aspirational. So we're really kind of looking for a balance between the 2. Our housing consists of 2 action plans. The first focuses on housing in an affordable housing sense, but we also did a specific action plan around homelessness. So that housing plan includes support for a regional strategy for housing affordability. And those were efforts that had already started in our community. It was identified in a priority area, and I think it was a strong approach to say, all right, this work is already underway, and we want to include that in the CHIP and continue to support that work. We also included an item in the CHIP to identify or establish an entity that would support the implementation plan. So development of that document was already in the works, but in our CHIP, we were able to also include an item to say someone is going to need to implement that plan once that's developed. In our homelessness action plan, we included identifying and supporting some alternative funding models for housing the severely mentally ill. And thankfully, as our legislative session starts in February, it looks like we're going to have some traction on some bills to address these at a statewide level. We also included community case management, specifically for those who are receiving housing assistance. So when we were talking with folks in our community about housing issues and how folks are able to access resources for housing, we heard a strong message that landlords really wanted to see folks be coupled with a case manager. So once they were placed in those housing assistance programs, that they were more likely to be successful. So you'll see some items around that in our action plan. We also included some work around youth homelessness. We have a rapidly growing youth homelessness population in our community, and we wanted to do some work to address that. Behavioral health, and again, we use that to combine substance use and mental health. We know that's a really big issue to try to get our arms around. And to develop this action plan, we worked closely not only with our stakeholders, but we also have a regional behavioral health board, and we got their input. So they, here in our state, we've got 4 regional behavioral health boards, and they not only were an opportunity to just tap into those stakeholders who are already gathered on the issue, but they were a body of subject matter experts that we were really able to get easy access to ask them, hey, what should we include in this action plan? The details of those action plans mirror our housing objectives. So again, those two are closely tied together. We also included some work to assess and address the current status and need for services, and that was in close collaboration with our regional behavioral health board. We also included reducing suicide and depression in adolescents. Here in Washoe County, we have youth reported rates of suicide attempts that are higher than both our state and national average. So we knew that was a priority here in our community. In our nutrition and physical activity action plans, when we were crafting those, we knew that there were a lot of existing groups that were doing work, and we saw an opportunity to bring that work together under one umbrella message. So we used that 5-2-1-0, which is 5 fruits or vegetables, 2 hours or less of screen time, an hour of physical activity, and 0 sugary drinks. And thinking about those messages, those are things that really apply across the whole lifespan. So we use that, again, as that umbrella to sort of tie that existing work together. These were some of our most widely attended meetings. So I think that shows really the level of interest here in our community. So again, we have one action plan to really tie those together. Not only looking at those 5-2-1-0 messages across the lifespan, but we also are looking at some healthy vending and how we can sort of improve those efforts in our community, and also continued support what we call family health festivals. So those are outreach events that we've been able to put on in our community, not only to provide some basic screenings and some basic services like immunizations, but also connecting folks with resources in our community, really with sort of a family focus. So looking to the future, we're continuing on implementation. We've got our work groups really active on those specific objectives. The smaller work groups that really, again, are kind of focusing on specific objectives thread up to a larger committee for each focus area, and those committees meet quarterly, not only for each work group to have that opportunity to sort of update one another on how the work is progressing, but that's also provided a great venue for folks who are interested but not necessarily involved in the initial chip development to come to the table and get involved in that work. We have owners and supporters identified for specific strategies. So those are the folks that we're looking to lead that work. But we provide that backbone support for committees. So we're helping pull meetings together, distribute information and communication to keep that going. We also take on an annual reporting process. So we'll be publishing a report in early 2019. I'm sharing the successes we've seen in our first 6 months of implementation. Some of our successes so far, here in our community, we have a lot of great groups doing work on youth homelessness, but we were able to develop a roadmap to really bring those efforts together and provide some structure to how we were going to go about the work of addressing those problems. And that youth roadmap we developed in a smaller committee. Then we were able to bring that to our area homeless alliance and get their approval on that. So again, kind of building that accountability and integrity to that work. In our youth suicide objective, we wrote in something specific to fund a program that had been existing but was going to run out of funding that provides suicide education and screening for all 7th graders in our school districts. It's 5,500 kids. but their federal funding had ended. We included an item to identify funding, and we were able to successfully do that, which is great. So we're going to see that program continue in a year, continue for the coming school year, and provide that suicide prevention and screening for every 7th grader in our community, which I think is really exciting. We've had 2 of our family health festivals that have already been conducted. Again, those provide some screening, basic health screenings, and also things like immunizations, in addition to resources. We also really have seen continued engagement of our committees and growing collaboration across our community. So in thinking about that goal of ultimately improving the health of the community, it's been really exciting to see folks come together and really stay engaged in that process and keep it moving forward. I wanted to end with just a couple tips for folks in the audience who may be thinking about starting that process to do a needs assessment and a CHIP. I think a great first step is just to look at some other needs assessments and CHIPs for communities that are like yours. We looked at communities of a like size, which I think is really helpful. We aren't a giant metropolitan area, so I tried to kind of keep it relevant to what our community, what our size was and what we looked like. Also, I want to encourage folks to look at some of those models. They can provide a really great framework for thinking about how to go about doing these really giant projects of a community needs assessment and a community health improvement plan. That process, of course, starts with the needs assessment. So you want to really have a good plan for how you're going to go about the work of that needs assessment and how that work is going to relate to your CHIP development process. What I found is picking what to focus on is the hardest part. And including a data prioritization in that needs assessment can really help tee up that conversation. But ultimately, you're going to need to get your community together, and humans are going to have to make that decision. So don't be afraid of that process, but get a good plan in place and think about how you want to go about that work. Do not fear the power of the group decision. I think for those of us who are planners and really like a really tidy process, it can be a little scary to put out big decisions like what are we going to focus on to a group. But I really want to encourage folks not only to think about how important it is for the community to buy into that work, but also think about all the wealth of knowledge you have in your community and tap into that opportunity for them to help you make those hard decisions. And be a relentless question asker. So it's really about what work the community wants to do, because you cannot do this work alone. So really get those stakeholders and get those community members around the table and engage them in this process. Finally, I want to end with a little quote. I think folks have probably heard this before. A ship in a harbor is safe, but that's not what ships are built for. And I've changed this a little bit to say a chip on a shelf is safe, but that's not what ships are built for. So I really want to encourage folks out there listening who want to improve the health of the community. Use that chip as your opportunity to engage people, get your community and stakeholders around the table, and get folks aligned on common goals so you can ultimately have a positive impact on the health of your community. And with that, I think we are going to take a few questions.
Yep. So we do have one question here already. I'm a case manager at NNRH in Elko. We frequently have a problem finding placement and PT rehab for our patients. We only have a skilled nursing facility rehab in our town. We frequently have to refer people out of the community for placements. We've tried working with the facility, but they are doing the best they can do. Any ideas on the next step?
That is a really detailed question. That is a little bit out of my realm, so I'm happy to try to connect you with some folks who may be able to help answer that question, but SNFs and rehabs are just really out of my scope, so I don't think it's appropriate for me to try to tackle that one.
Okay. So I will respond to you. You can actually email me, and I can connect you. Sorry, just thinking here. So if there's any other questions out there, please feel free to write in using the chat function or the Q&A function. We have about 10 minutes, so feel free to ask anything you like. Any questions out there? All right, I'm not seeing any. So thank you so much, everyone, for joining us today. Hope you have a happy holiday season and a happy new year. Thanks.